sinusitis in an ENT OPD is a little bit rare when you talk about an invasive fungal sinusitis that we do come across after COVID-19. A lot of cases we are encountering day to day. More so, especially with the second wave. We did had a few cases in the first wave, but it definitely COVID-19 definitely had a severe impact in the second wave, which the patients have suffered. As of it, COVID-19 has caused a severe impact on the lifestyle and the health of all the individuals who suffered or who has not suffered from COVID-19. But in spite of all that tumultuous period of hospital admission, complications, ICUs, and patients, when they have come out, the fungal sinusitis has appeared. But before we discuss more of post-COVID fungal sinusitis, I would like to enlighten a few aspects about acid sinusitis and the COVID-19 association. For a common man, sinusitis is nothing but sinuses are the air-filled spaces in the bones, in the facial bones, which keeps your head light and also gives resonance to your voice. So the sinuses are lined by a thin membrane called mucous membrane, which actually ventilates the cavities, and also air keeps circulating after entering into the nose, into the sinuses, and they're driven into the lungs. So the nose and sinuses act like an air condition to the lungs, it filters, it humidifies air, and then it comes to a body temperature, the air that is going into the lungs. So it has got its own protective effect on the lungs. So bypassing or any infection on the nose can lead to sinusitis. Any blockage of this airway tract leads to sinusitis, so that it bypasses the lungs. The air goes into the lungs directly from the unprotected air, goes directly from the mouth into the lungs, and then a few problems can occur when it goes directly into the lungs. So when you talk about a sinusitis, it can be a fungal sinusitis or a bacterial sinusitis or an allergic sinusitis. Anything is a possibility. But in a COVID period, when we are going through this difficult period, how do we recognize a COVID-19 infection, or is it a sinusitis? Like both mimic each other in a lot of ways, but the one particular way of identifying is that COVID is more like a dry cold. If you talk in normal general terms. When I say dry cold, it is not a very running nose. You'll have a cough, more like breathing difficulty, and also you'll have fever, and you can have a headache, of course, and body pains. General viral infection kind of symptoms you will have. And one distinguished feature of a COVID-19 cold is that some people they're having either loss of taste or smell. When you lose a degree of smell, you'll also lose the taste. So that's the most distinguishing. In a normal sinusitis, also person can have loss of smell, but not to the extent like in COVID. And also, in a sinusitis, it is more chronic. It stays in weeks, and there can be a prior episodes of cold, more running nose, like watery nose, or anything like phlegm or anything can come out from the nose. And they'll have headaches, facial pain. The pain, so this slight, but when you are in doubt, you consult a GP, get your COVID-19 test done, like RT-PCR or rapid. RT-PCR is more recommended. Okay. So once it's confirmed, like what that's a different topic. But this COVID-19 impact on fungal sinusitis has been enormous, to put it straight. Because, as I said, that the number of cases that has come up post-COVID or pre-COVID era, I can put it as pre-COVID and post-COVID era. The numbers of people who got suffered, whether it is an extensive disease or mild to moderate disease, has been significant. So it requires a little bit of attention, and also people need to know when to actually alarm themselves. So there has been so much of psychological pressure on the patients and also the attendants, even for the smallest symptoms. They started running to the hospital and then want to get checked up. So, what is that you have to actually identify that whether you have a fungal sinusitis or not? So, to talk about whether the sinus is fungal or a bacterial, we need to know what a fungus is. Fungus is an intermediate type of species where it cannot generate its own food, unlike plants which generates its energy from the sun. The fungus cannot. So they live on some sort of medium or some sort of plant or an animal to get its energy or rather its own glucose, whatever you say. Like so, to do that, they are called saprophytes. So they do live on generally on the manure, soils, vegetables, or you can also say that they are commensal organisms because they do live in the general nasal cavities and also in the gastrointestinal. So they don't do any harm because because our resistance is so high, so that the sun fungus will not penetrate into the body of it doesn't damage the cells. So in that way, we have number of evils. I can say that all around us, but we are not. God has given us a protective gear like immunity. So we are warding off all these evils from us. But what happens in a COVID-19 situation is that because or in any general immunocompromised patients or individuals, I would say, like people who are suffering from diabetic ketoacidosis or uremic acidosis or leukemia patients who are on cancer treatment drugs for a prolonged time, whose counts go low down, so that the fungus takes over the body fighting system, and then it starts invading the cells. There are a number of fungal diseases. When you talk in an ENT, there can be something called a fungal ball where the fungus multiplies and forms like a ball, which will not go deep into the tissues, but it stays there in the sinus cavity, where you can wash it off, or and then if it is allergic, this thing you can do some intranasal steroid sprays. So you can they are generally considered a low grade infection, not but when in a COVID, the fungal sinusitis would be like more fulminant. It can damage uh, one particular um, fungal disease. What we are talking, there are a number of fungal diseases like Aspergillus, Candida, or Mucar. So the Aspergillus candida can be like they can all in regular patients also we do come across, but not the invasive variety. Invasive variety, as I already told, that they do come in an immunocompromised, more in an immunocompromised individuals. So what we are talking about in post-COVID, the mucormycosis, which is also called the black fungus because of the disease itself presents as a black scabs that appear in the nose or anywhere. So the fungus, which also is a as I said, that is a commensal organism, will take its own course of aggressive. It shows its aggressiveness, which can be like fulminant, where it eats up lot of tissues, and then so out of which is the rhinocerebral variety, orbital variety, is the most common mucormycosis. So it from the nose, it can enter into the eye or into the brain, and then it starts digging into the tissues, and then takes away a lot of vital structures along with it. So this while this fungus has a predilection towards the supply the arteries of a body. So it invades, it gets into the artery, any artery where it is the fungus is nearby. So it eats away the arteries, and then it causes the thrombosis of that artery, and then later on that tissue, the artery which supplies to the tissue, dies off. So it's a sort of more like inflammatory and necrotic pathogenesis that actually happens. So when it is necrotic, it appears black. That is called the black fungus. But people, what the doctors know, like what is going through the patient's disease. But the patient also should know when they should be warned of this fungal disease, especially post-COVID, because of the sequelae that is resulting. If untreated, it is going to cause enormous damage to the patient vital structures like the eye, or if it is entering into the brain, that is you know uh, difficult situation to manage. So whatever it is, like people do say that excessive steroid usage or whatever it is. There is a discussion always goes on why it is happening in wave two, not in wave one. So the only difference which comes to our mind is that wave two, the COVID-19 the variant is more severe, and it has caused more immunocompromisation because the steroids have been used in wave one also, and wave two also. So this is like uh, wave two has the patients have suffered because of the virulence of the second wave strain. So that's how we have concluded. Yeah, steroids, usage of steroids need to be restricted. We come to that a little bit later. So how do you know that you do have a sinusitis in a post-COVID situation, not or in a COVID disease patient? So the first symptom would be that the patient can have a lot of pain. Pain is in disproportionate to the physical signs of whatever is the disease, like sinusitis disease. So it could be either that way, or it also can facial pain. When we talk about pain, it can be a facial, or it also can be a slight numbness or any blackish discoloration of the skin or in the oral cavity, like on the palate or anywhere. So one should be taking it as a warning. So they need to come to an ENT or physician. They should immediately report it to the physician, and then there can be fever. There need not be any fever. There can be a cold or a headache. Or a vision loss if it is affecting the eye, or any central nervous system features like meningitis or anything can happen. So all these things that a practicing doctor would be able to recognize these symptoms later on. So the first sign of any disproportionate pain or discoloration, what is the after what is the test of choice to diagnosis? You can go to a CT scan or an X-ray. They are not very pinpointing in diagnostic help, like of diagnostic help. So the MRI is the main study which you one need to do, sinus and orbital MRI, and then look for the disease where it is how it is spreading. So having if we diagnose fungal disease, like how do we go about it, and how we treat that? There are a few medications. It depends on the severity of the disease. We need to approach the patient. This is the one situation where I seen when I studied my post-graduation or my medicine. There was a dictum of saying that you don't treat scans, you treat patients. But this is one situation where I seen that you need to treat the scans. You don't wait until the patient reacts or the patient shows up. So because you silently this fungus which is eating away the tissues or destroying the tissues need to be arrested. So how would we do that? So there are a few things like you do have some medications, medical and surgical is the obvious this thing. Surgery need to be done to remove whatever is there to arrest the spread of or take away the source of material, whatever is the destructive tissue along with the fungus that is present in it, and also do an extensive resection so that even there is a zone of spreading zone that also need to be removed. So it's like sometimes it is a mutilating surgical procedure, but an endoscopic way of doing generally it is okay, and you can associate yourself with your oromaxillary surgeon and also neurosurgeon through an endoscope or an open method. How do we remove the disease part is a clinical judgment. It depends on the severity of the disease, how whether it is a mild, moderate, or a fulminant spread of disease. We need to take a call on that. And we do also give antifungal treatment. Uh, there are cases of not only mucor but also the aspergillus and also the candida also have been encountered during this process of post-COVID fungal sinusitis. So all the things need to be kept in mind, and then for a mucor, it is that liposomal amphotericin is the drug of choice because it has a lesser kidney toxicity, and then it is better tolerated. But the availability is of a concern because of the supply. Sudden rush of demand has caused supply in uh, in a sort of problem for the government as well as everybody. So plain amphotericin also can be given, but need to be monitored more extensively, and it need to be given in days of gaps so that the nephrotoxicity do not occur. While doing a surgery, also wash antifungal material amphotericin wash can be given so that the local effect will be there. So once the antifungal treatment can be given, like 3 months, 4 months, 6 months, number of time, and the dosage would be like a 5 milligrams per kg, 3 to 5 milligrams per kg body weight, or it can be given. Sometimes it is given in literature. Some people talk that they have given more than 10 milligrams per kg body weight, depending on again the disease severity. So a lot of aspects. It's not a simple treatment or a simple disease post-COVID fungal disease because the damage to the vital structures impacts severely. Loss of vision is one thing uh, which is not a simple thing to talk about, or any mutilating disfigurement of tissue destruction on the face itself has a tremendous effect. Moreover, when you talk about the economic situation, because of the prolonged treatment, the cost is increasing. As of then, the patient has come back from the COVID treatment, and over and above that, the psychological, economical lot of things have been uh, uh, impacted on uh, the disease process and on the patient's condition. Uh, so, so what? How do we you prevent to save you from getting into that? So as I said that the fungus is always present. It is almost like a ubiquitous in a, any dead tissue or anything, or even on a normal patient's, on a human being's nose or gastrointestinal tract. But what we need to take care is that you need to have a good diabetic control. If you're on a chemotherapeutic agents or medication, you need to follow up with your physician, tell them, and then there are concerns about the humidification of oxygen. Yeah, we need to take the hygiene part, like all the things. Wearing of masks are also like if you contaminated masks. So the general, the washing your hands, so all these regular precautions need to be taken wherever it is required. So it's better not to go for local steroid, or sometimes patients are, because there's so much of um, media, or I would say that so much of material that is available of the treatment aspect. Some people who had come to us, they started their own steroid treatment without any somebody's guidance, like a physician's guidance. They do because these are all the aspects which can lead to your immunity lowering, and which will give a chance for the fungus to grow and attack your own defense system. So your defense system is the main armory. Your armory is that. So we need to protect that. Uh, so that is about the fungal sinusitis. I just want like to tell you that people who have anosmia or loss of smell because of the COVID, generally it returns back in 3 to 4 weeks of time. But if it is not recurring, in the UK they have formed a club by saying it is a fifth sense club. So fifth special sense, what they are calling it. Because they are, it is being the smell is being trained. The patients are subjected to, the individuals are subjected to inhale smells at regular, even though they don't feel the smell, but they are trained to, they are exercised to keep on smelling the essential smells like the eucalyptus, clove oil, and then the lemon oil. These are given only because of their content of smell will not change over a period of time. So it is being, they are being exercised to smell so that the nerves regenerate, and then the smell come back over a period of time, like how a muscle hypertrophies, or wherever there is a physical denervation, or how we do a physical exercise, physiotherapy, how it is given. Even the same way, the smell exercises are also being done. So that is helping people. At least 30% of people are getting back to their to near normal smell sensation. So that is one way of doing it. And so the fungal sinusitis, I think I covered a lot of aspects on that. If anybody has any questions, you're welcome, and here to answer you. Yeah, that's the topic has been completed. If anybody has any questions.